coronavirus continues spreading in Kansas and Missouri. Good afternoon, everybody. I'm Chris Ketz. Lara is off.
And I'm Kelly Eckerman. In Kansas, more than 7% of tests are coming back positive. That's more than doubled since Friday.
And it's more than 12% right now in Missouri. We'll tell you about worries over not enough hospital beds in the Show Me State in just a moment.
We begin in Lawrence. KMBC9's Matt Fleener reports cases are rising even in one of the most vaccinated areas of the state.
Hi, welcome. We were probably one of the most cautious businesses on Mass Street.
At Wonder Fair along Mass Street, face masks are still required.
Huge fan of the vaccine, love it.
Co-owner Paul DeGeorge says vaccines save lives too, trying to run a business as safely as possible, knowing cases of COVID and the Delta variant are on the rise.
We have a kind of a small store as well, and it can get pretty crowded. And also knowing that children are still unvaccinated.
DeGeorge heard the news Monday that 62% of new COVID cases in Douglas County are people eligible for a vaccine but have yet to get one. That means a third of cases could be young children, people who've had just one shot, or breakthrough infections where vaccinated people get the virus. But
none of the cases of breakthrough infection have the serious complications associated with it, so they are considered to be the more mild cases, so they're not causing hospitalization.
Workers with the health department are still trying to vaccinate as many as possible.
What we are doing right now is a lot of community clinics,
encouraging everyone in the community to stay safe.
Right now, we don't have to worry about what our next move as a business is, because we're still requiring it, and that feels comfortable for us anyway.
That was Matt Fleener reporting. Right now, the average new daily case count in Douglas County is 4. That's compared to 1 per day just a couple weeks ago.
On the Missouri side, some local hospitals are treating COVID patients from other parts of the state. KMBC9's Bianca Beltran spoke with hospital staffers about the ability to handle more cases. Bianca?
And staff I spoke to at hospitals here in Kansas City say they are able to manage the number of COVID-19 patients they have right now, but say that hospitalizations can be prevented.
The numbers are way down from where we were at our peak, but the numbers are going up, which is concerning when you take a look at the Delta variant going around in the state of Missouri.
Steve Hager works at Truman Medical Center University Health. He also coordinates with hospitals across the metro through the Mid-America Regional Council's Healthcare Coalition. With a surge in COVID cases across the state, some Kansas City hospitals have taken in patients from harder-hit areas, but Hager says many are running near capacity.
And should we start to see a high number of COVID patients like they are there, we're going to be very challenged with how many beds we have available.
In addition to the typical workload, he says hospitals are seeing patients who delayed care for months.
I think of any message to take away from this, help the hospitals, help you as the public, and we need you to get out there and get vaccinated if you haven't already done so. The hospitals are full, our staff are tired, and anything you can do to help keep the volume off of us is what's going to help us come out of this.
Now, usually the network of hospitals can refer patients to other health systems in the area when they are really busy. But last week, there were several days where several hospitals were experiencing a high volume of patients. Reporting on Hospital Hill, I'm Bianca Beltran, KMBC 9 News.
And as for local vaccination rates, Johnson County, Kansas is closer to reaching half its population fully vaccinated. It's 40% in Clay County. It's above 36% in Kansas City, Missouri, Jackson and Platte counties. It's above 32% in Cass and Wyandotte counties.